Hello everyone, this is Diane and this is part 1 of chapter 3 in hematology. So this is our hematology unit. What is hematology? You know from medical terminology that ology, the suffix ology, is the study of, and hema means blood. So this is the study of hematology. This is the study of blood. It is the study of the blood itself, the different cells that make up the blood, the tissues that form the blood cells, and then of course it is the diseases of the blood cells and of the tissues that form the blood cells. We will be talking about all of that as we go through this unit. If you're watching my screen, you can see all of the items that we'll be discussing in this part 1. And also, if you want to follow along in your book, we're starting on page 74. Over on page 75, you'll see some bulleted points that are the same as what you see on your screen. We're talking about blood being made up of 2 parts, fluid and cells. In this case, the fluid is going to be called plasma. When we have blood that we collect from the patient and it stays whole, meaning that it is not clotted. We do not allow the specimen of blood to clot. That means there's an anticoagulant. That means against clotting. There's an anticoagulant inside the tube before we draw the blood. So that anticoagulant will prevent the blood specimen from clotting in the tube. That way we can then look at those cells underneath the microscope. If we allowed the blood to clot, we could not look at intact cells underneath the microscope, nor could we count them. We have to count them in an automated instrument. So when we have the cells and then we have the liquid part, in the anticoagulated tube, the liquid part is called plasma. Let's talk about the 3 basic cell types. We have leukocytes. You remember leuko from medical terminology meaning white, erythrocytes, erythro meaning red, and thrombocytes, thrombo meaning to clot. Most of the time we don't use those terms. We abbreviate and say WBC, RBC, or platelet. So let's talk about leukocytes. We have many different kinds of leukocytes. These are the body's main defense against bacteria and viruses. And they're divided into lymphocytes, monocytes, and granulocytes. And then underneath granulocytes, those are further divided into neutrophils, eosinophils, and basophils. I'm going to go through what's on the rest of this document and talk a little bit about it, and then I'm going to go out to the web and show you pictures of these different white blood cells. I'm going to show you pictures of erythrocytes and pictures of platelets. But let's finish up our talk here. Erythrocytes are another name for red blood cells, or RBCs. They are very important because they carry oxygen and carbon dioxide between lungs and body tissues. So if we don't have enough of them, then we don't have enough oxygen, and that's a bad thing. That condition or disease would be called anemia. There are many different kinds of anemia, and we'll talk about that in a later recording. The part of the erythrocyte that is what binds to oxygen and binds to carbon dioxide is a compound called hemoglobin. It's a very large molecule, and the center of the molecule is iron. So sometimes we say, oh, my patient is low in iron, or maybe you had a family member, my grandmother is low in iron. So that means there's an iron deficiency anemia. If he or she was low in iron, then that means that the hemoglobin result. When the doctor ordered a hemoglobin blood test, which we'll be doing in our laboratory, the hemoglobin result was low. So if hemoglobin is low, then the patient isn't getting enough oxygen to their cells and to their lungs. And carbon dioxide isn't becoming transferred back to the lungs and then exhaled out. So those are not good things. So I'm going to be showing you pictures of erythrocytes or RBCs. And then thrombocytes, again, we don't usually refer to that term. We call them platelets, and their main function is to stop bleeding. Blood cells are made in the bone marrow. So when the doctor really needs to look at if he thinks there's a problem that not enough cells are being made, or maybe some are being destroyed somehow, he will look at a sample of the bone marrow. The process within the bone marrow that means to make red blood cells and white blood cells is called hematopoiesis. The suffix poiesis means to form, or the formation of. So this is the formation of blood. Within the bone marrow, the blood cells are actually immature. They go through a maturing or a maturation process, and then they are released out into our peripheral circulation. So when we draw a blood specimen, that specimen from the vein that we're drawing from is peripheral blood. So we're not drawing a bone marrow sample, we're drawing peripheral blood sample. So after this maturation process, the mature cells are released out into the bloodstream. So let's go out to the web now and take a look at all these different cells. Here you see several things. These lot of pink cells out here, these are all red blood cells or erythrocytes. This large one in the middle is a white blood cell. It is a lymphocyte. It's kind of small. It's a little bit bigger than the red blood cells. But what you can see, a major difference is it has a nucleus. You see a very, very dark and tight nucleus here. Of course, you know the nucleus is what contains the chromosomes, the DNA, the RNA, other things that control the life of the cell and the function of the cell. Out here, this lighter blue area is the cytoplasm. So when you look at this compared to these, of course it's much darker, but it also has a nucleus. This is a white blood cell called a lymphocyte. It fights viruses and it also makes antibodies. So it's extremely important in our immune system. Also, what you see are these tiny little purple dots, and these are platelets. So they are much, much smaller than even the red blood cell. It looks like maybe they're inside these two red blood cells, but they're not. They're sitting on top. So this is a white blood cell called a lymphocyte. We have some red blood cells here, and we have some platelets. Here is a segmented neutrophil, and if you look in your book on page 76, this corresponds to the C diagram. This is a segmented neutrophil. This is the most abundant. As you can see up here, 40 to 75% of peripheral white blood cells are this segmented neutrophil. Sometimes we call them segs and sometimes we call them polys. because poly means many, and there are many segmentations. So what you see are in this nucleus, the lobes have these little threads that connect them, and so because the lobes are segmented, we call it a seg or a poly. You can see a lot of cytoplasm here. It's lighter in color, and you can kind of see some pink, a little bit lighter pink granulation. There are granules here. So you have multiple lobes, or polylobes, a poly or a seg. This is a polysegmented neutrophil. And this white blood cell likes to kind of eat up bacteria. It kind of envelops a bacteria and ingests it and eats it and digests it and spits it out. And when it's no longer able to function. And that's how it fights a bacteria. Of course, here you see some red blood cells, and here you see a platelet. This is a mature polymorphonuclear segmented leukocyte. Okay, the next slide I'm going to show you is this same cell before it became an adult, before it became mature. It's kind of, what I'm about to show you is like the teenager form of this cell. Well, here we have the teenager form of this cell. We call this a band neutrophil. So this is a little bit immature, and it didn't get its segmentations yet. There's a normal range for these, about 1 to 3%. So when we see more than 3%, when we're looking at the patient's white blood cells, then we know that there must be a sign of a bacterial infection, because the bone marrow will be putting out more than it should. So its adult partners must need extra help to fight a bacterial infection. So this is a band neutrophil, and this is letter D on page 76. Here we have a monocyte, and this is letter F on page 76. This is the largest white blood cell. You can see the red blood cells here. You can see some platelets here. And this has what we call vacuoles in the cytoplasm. Cytoplasm kind of sometimes is described as looking lacy. And the nucleus here kind of forms into a kidney shape or a horseshoe shape, and this is very large. Okay, and sometimes the cytoplasm gets what we call pseudopods, which mean false feet, kind of sneaks around, and it also can envelop bacteria and ingest it and spit it out. So this is another type of white blood cell. It is the largest white blood cell, and it is letter F on page 76. Here is what we call an eosinophil, and this is the cousin of this polymorphonuclear. It has segmentations. This one had pink granules, very light pink granules, and this one had very dark or sometimes red or orangish pink granules. This is the cousin. If you look very hard, you can see the segmentations in the nucleus. So this is a segmented neutrophil, but the granules are a very dark pink. Sometimes they get to be even orange. We call them eosinophils, and there is a normal range, about 1 to 4%. When these are increased, it's usually a sign of hay fever season, or the patient has other signs of allergies. So this is a cousin of the, sorry about that, the segmented neutrophil. This is a cousin of that. Another cousin is what's called a basophil, and this is also segmented neutrophil. The granules in this one are so very dark that you cannot see the nucleus. You cannot see the segmentation of the lobes. All you see are these very, very dark granules. But this is a segmented neutrophil. It is the cousin of this band and this mature, but the granules are so dark that you cannot see the segmentations. So this also is a segmented neutrophil. You only can see these dark granules. And last but not least, we have a picture of platelets. You see these small little purple things that I've mentioned before, and you see some red blood cells. It looks like the red blood cells maybe have holes in them, but what we're looking at is a flat picture. But what the picture was being taken of is really three-dimensional. And if you've ever seen like a Smartie, a candy that's a Smartie, and you know that they're kind of a concave shape, or think of a Frisbee where the inside is carved out. These are kind of shaped like that. They are biconcave discs, and that helps them to get through tight quarters within the body much better. They have to travel through little bitty capillaries in your fingers and your nose and your toes. They have to get through mountainous areas in the spleen. The spleen has mountains and valleys in it, and they have to be shaped in this biconcave way to be able to get through. And that is the end of part 1.